Representative Richardson, would you like to move that House File 813 be laid over for possible inclusion in a future Education Finance Division report?
Yes, so moved, Mr. Chair.
Very good. Thank you very much. And I understand that there is an A1 author's amendment. Would you like to move that to be before the committee?
Yes, please, Mr. Chair.
Members, this is an author's amendment. Representative Richardson has moved it. Is there any discussion to the amendment? Hearing none, all those in favor signify by saying aye. Aye. Opposed? Motion prevails. Representative Richardson, then, to your bill as amended, please.
Thank you, Mr. Chair. So House File 813, as amended, would require the Minnesota Department of Education to award a $480,000 grant to a nationally recognized provider of evidence-based training on suicide prevention. The grant recipient would be required to make this online training available to teachers statewide. We are facing a serious public health crisis in our communities and in our schools. Suicide is the second leading cause of death for youth between the ages of 10 and 17, and we know that there are intersections between mental illness and suicide. In fact, there was an underlying mental illness in 90% of the youth who completed suicide. In Minnesota, there are also troubling statistics as the completed suicide rate for 10 to 19-year-olds is higher than the national average. In 2016, 48 youth between the ages of 10 and 19 died by suicide in Minnesota. According to a Minnesota Department of Education student survey, 496 eighth graders reported that they had seriously considered suicide. By 11th grade, that number almost doubles to 9,352 students reporting that they've seriously considered suicide. Public health crises require community-based responses and strategies. And while these statistics point to a serious public health problem, we know that suicide is preventable. The realities are that our kids spend a lot of time at school, and it's one of the primary places that they're living their lives, and so focusing on suicide prevention at school makes sense. It's where our children are, and it's also where problems can manifest. One part of the strategy is ensuring educators are effective partners in suicide prevention. We want to make sure that they're better prepared to effectively identify students who are at risk and that they have the tools that they need to engage with students and the appropriate follow-ups. This is going to be important to ensure that they have the necessary skills and the confidence to intervene with at-risk youth. In 2016, legislation was passed in Minnesota requiring teachers to take 1 hour of evidence-based suicide prevention training as part of licensure renewal. We have some testifiers here today that will speak to the benefits of that training, but for some schools, there have been challenges. There's been challenges with training implementation, organizing that training, and ensuring access to quality and evidence-based content across the state. This bill is an opportunity to ensure schools across the state have access to an online evidence-based suicide prevention training. And by bundling contracting resources with one provider, it offers a cost-effective way to build the capacity of teachers and to create schools that are more effectively able to identify at-risk students and intervene as well. With that, I can stand for questions, or we can move on with our next testifier, Sue Abderholden.
Representative Richardson, let's move on to testifiers before we take questions. Ms. Abderholden, welcome to the committee. Please state your name for the record and proceed with your testimony.
Thank you, Mr. Chairman. Members, Sue Abderholden, Executive Director of NAMI Minnesota, National Alliance on Mental Illness. And I want to thank you for hearing House File 813, which would fund the online suicide prevention training for teachers, which is actually language that you also passed last year. So as you know, the legislature passed a bill in 2016 requiring teachers to have 1 hour of suicide prevention training. And this was in response to the increased number of youth dying by suicide and the increased number of students in the student survey responding that they had thought about or attempted suicide. In a national report released in May, researchers found that suicidal ideation has steadily increased and that half involved teens aged 15 to 17, 37% were ages 12 to 14, and almost 13% were children ages 5 to 11. Girls made up nearly 2/3 of those cases. Now, we don't expect teachers to treat students, but we want them to know the signs and symptoms, and most importantly, what to do if a student shares that they or a friend are suicidal. NAMI provides a mental health education program for high school students called Ending the Silence. And after nearly every presentation, a student approaches my staff worried about themselves or someone else. We encourage schools to let us do the 1-hour evidence-based class to teachers. It's called QPR, Question, Persuade, and Refer, so that they know what to do if a student comes up to them after we leave. QPR is good and it's short, but it's still hard to arrange for all the teachers and staff to be there at one time. In 2016, the Minnesota Department of Health put some funding towards trying out an online suicide prevention training. The money was actually funneled through NAMI so that we could track the schools and the outcomes. There were 30 schools and 1,064 staff completed the training. 95 to 97% said they would recommend the training to a colleague, which is a very high number, and 79% said that they were more prepared to discuss the sign of distress with a student after the training. Charter schools actually had the highest usage of the training. People who took the training said that the scenarios seemed real, that they actually had students like that, and that they appreciated being able to practice speaking to the student or the parent. Funding the online training for all teachers and staff across the state does bring efficiency in terms of funding. You get a better deal the more schools that you cover. But it also eliminates the barriers that teachers and staff have accessing training, especially in rural Minnesota. And frankly, it's a much better training than what we have now, much better than QPR. We are all concerned about the mental health of our youth, so let's make sure that teachers and staff has the best training possible to prevent suicide among our students. Thank you.
Thank you, Ms. Abderholden. Representative Richardson, you have other testifiers?
Yes, we have two other testifiers.
Good morning. Welcome to the committee. Please state your name for the record and proceed with your testimony.
My name is Tamara Pulver. I work as a director of special ed with charter schools. Good morning, Chairman and committee members. It's an honor to address the House to advocate for House File 813. I work with charter schools, and due to the smaller setting, we get a large number of students with disabilities. The enrollment is greater than the state average. Majority of these students are dealing with mental health issues and trauma. So, you know, staff always wonder and ask, what's the difference between a student that just needs to buck up and one who's in serious trouble? It's really every day in Minnesota schools, teachers, paras, office staff, bus drivers, and food service people all have to interact with students that are engaged in self-harm, suicidal ideation, despair, and hopelessness. Knowing how to respond is critical to the health and welfare of the child. We all want and need effective training in suicide prevention. I received a grant for all staff at my charter schools to access the Cognito training. It was well received, even by veteran social workers. The interactive role-playing of students from different backgrounds with different needs was very instructive, and the feedback was all positive from staff. There are 3 different developmental levels: elementary, middle school, and high school. And adults can log in at school or at home. They can stop and resume the training as needed. Staff from Greater Minnesota and the metro area, where all my charter schools are, had equal access to the training when it was convenient for them. As you know, licensed staff must complete the suicide prevention training. The beautiful thing about Cognito is how available and accessible it is to all non-licensed staff, many of whom have deep and meaningful relationships with our students. Cognito instructs staff how to talk to vulnerable kids, what kinds of questions to ask, when to refer them, and how to support them in getting help. It's so important that we all have this knowledge to recognize when our kids are in serious trouble and need us the most. People that die by suicide do things and say things that are tells. So we need to instruct our staff what those things are. We need more resources for schools to address mental health needs for our students. We need training for all the adults that interact with students. Cognito training is for suicide prevention is desperately needed now, as the death by suicide rate is sadly increasing. I want to thank you for your time and your thoughtful consideration.
Thank you, Ms. Pulver. Representative Richardson, you have one other testifier?
Yes, we have one more testifier, Ms. Muckenhern.
Good morning. Welcome to the committee. Thank you for traveling down today. Please introduce yourself for the record and proceed with your testimony.
Thank you, Mr. Chairman. I'm Barb Muckenhern. I am the principal at Princeton High School. Good morning. Thank you for this opportunity to speak on behalf of supporting the Cognito Suicide Prevention Training through NAMI, Minnesota. I've been the principal at Princeton for 6 years, and in this time period, students presenting with mental health and social emotional issues has gone from our primary concern to an overwhelming need that we cannot fulfill for our students. Not only are schools understaffed in this area, schools actually have a lack of trained staff members. We do not have a social worker, for example, at Princeton High School at all. Continuing education for teachers, for teacher licensure is now required in the area of mental health awareness and suicide prevention. However, it is actually a challenge very often for teachers to acquire this training and quality training. School districts are trying to provide it, but it's not easy to do so. There's a limited professional development time in the yearly calendar, with many needs and other requirements also vying for this professional development time and funds. Even when we might have time allocated or allotted to this training, it becomes a challenge to find the quality training. Our expertise in schools, sadly, is not mental health counseling or suicide prevention. So we struggle to even develop our own quality training. When the opportunity arose a couple of years ago to work with NAMI Minnesota to provide Cognito training, I thought, I've got to give this a try. I haven't seen anything else like this, and I haven't seen anything else like it since. To my surprise, it was a quality experience and provided the following benefits. It was free to our middle school and high school staff, all staff. That was a gift. Staff could access this training day or night, which was extremely convenient. The system was easy to use and worked as intended, which is a surprise. So even though we were among the first, the glitches were very insignificant and easily solved. The training was interactive and the learner is forced to engage. You can't just click through the training. The training was effective and staff liked it, and that matters. Our activities director, Mr. Labs, shared this quote that I could share with you today. I thought I would breeze through it, but that was not the case. I was surprised at how helpful it was. It kept looping me back to the student in the scenario until I made choices that ended in something helpful for that student instead of a dead-end choice on my part that shut down the conversation. And I've had similar feedback from other teachers. I strongly urge you to support providing this training to the education community in Minnesota. Our students need us to know what to do. And that only happens with quality training and learning opportunities such as the training like Cognito can provide. Please help us help our students. This is the most important thing we do. Thank you.
Thank you, Ms. Muckenhern. Members, in your packet additionally is a letter from Ms. Charbonneau-Folk from the Big Lake Schools, also in support of the training. Representative Detmer.
Yeah, thank you, Mr. Chair, and Princeton High School. Please, I'd like to just, on behalf of my brother, Lee Detmer,
No, of course it is.
who taught at Princeton for 30-plus years, and I think retired, what, 3 years ago, 2 years ago?
Ms. Muckenhern.
Like 4.
4 years ago.
4 years
okay.
ago.
But just wanted to say hi. You know, just tell, when you see Lee, just tell him you met his better-looking brother.
I will certainly do that.
I believe he sent the same message to her beforehand, so.
We're just 18 months apart, so.
It's great to meet you.
Representative Edelson.
Thank you, Chair, and thank you, Representative Richardson. This is such a great bill and such an important area that we're addressing here. I just have a few questions. I want to know specifically, how long does the training take? I actually checked out Cognito's website, and it's really, if you haven't looked at it, I would suggest going on. Very user-friendly. But also, what areas of mental health training does this cover? As somebody that's practiced as a therapist myself, we know many different avenues can lead to suicide. And so I don't know if it would be better for Sue Abderholden to come up and address that.
Representative Richardson, who's taking the pitch?
Sue, I think, can answer those questions.
Ms. Abderholden.
Thank you, Mr. Chairman, Representative. It covers really more, if you think about suicide prevention training, you're not trying to diagnose or anything like that. You're trying to figure out how to question and talk to the individual who may be suicidal. And so it really focuses more on that dialogue and conversation about what to say and how to engage, not just, as I said earlier, shutting down the conversation. So it really helps you learn how to do that. And then you refer. So you're not necessarily handling that crisis, but really trying to figure out if, in fact, that student is suicidal, and then where do you go from there?
Representative Edelson.
And then how long does the training take?
Ms. Abderholden.
Mr. Chairman, Representative, it's supposed to take an hour, but we've also heard that sometimes, because that's the hour that's required, which is why we looked into this. But if someone wants to kind of keep going back over and over again, it could, of course, take more than an hour. Or if they keep answering wrong, frankly, it's going to take a little bit longer.
All right. Representative Edelson.
So just one more, thank you, Chair. So this covers the suicide 1-hour training from past and previous session.
Representative Richardson, Ms. Abderholden.
Yes.
Thank you. Thank you, Chair.
Thank you. Representative Detmer.
Yeah, thank you, Mr. Chair. On a little more serious note here, I know we provided some funding last year in the bill. Staff development money, I know that's set aside at 2% each year for a school district's budget. Could this be run through staff development? That's my question.
Mr. Strom, can you review for the committee the 2% set aside and the requirements around that, please?
Mr. Chair, members, part of each district's general education revenue, 2% of the formula allowance is set aside for staff development activities, and those activities now are under the control of the school board. There's a list in statute of the activities, but I presume a class like this or a course like this would fit under the requirements in 122A60 for staff development.
And Mr. Strom, to your reference that those monies are currently under the authority of the school board is a reference that previously it was control of those monies, if I recall correctly, went to the staff development committee, and so it was teachers and administration jointly making decisions on the expenditures. Can you remind me, help me?
Mr. Chair, members, there was formerly in statute, there was a three-way split, including some money decided at the site level, some money decided by the board level for site-specific activities. But it was a three-way split before the most recent set of changes.
Thank you very much. Ms. Abderholden?
Mr. Chairman, if I could add, including in last year's bill, one of the reasons not to do it school district by school district is because if you go in with one state contract, you frankly get efficiencies, cost efficiencies in there, and so the total cost is a lot less, which is why even last year and again this year, we're proposing to do it that way.
Representative Detmer, did you have more?
Yeah, and I understand, my 34 years teaching, there's always a big demand for the staff development money. And teachers will put in their requests. The district would have their programs that they set aside with staff development money. So that was just a question that I know if you look at a school district budget of $70-some million, and that's a pretty big hunk of change for staff development. So just wanted to point that out.
Thank you, Representative Detmer. Ms. Abderholden, while this may be an appropriate response to the increase in suicidal ideation being seen amongst youth, how do we get below the response to the causes? Do you have insights? Is there research that provides insights into why we're seeing the increase in suicidal ideation?
Mr. Chairman, some of the studies I've read look to a number of things. One is contagion. So what you see is maybe in a high school, you see one student take their life, and then soon after, several others. And part of that, frankly, is how we communicate and message that. And the health department, through their public health nurses and departments, are also trying to work when that happens in a school to actually work on making sure that you're doing the right things, not to promote contagion. One key example, for example, is you never tell and never share in media or anything how someone took their life. Asking someone if they're suicidal does not plant the thought, but actually talking about the means that they use does. One example is after Robin Williams' death, where the media, frankly, was horrible in terms of putting out every single detail. There was a huge increase in the number of people who died by suicide by those means. So there are things like that that we need to work on to make sure that we're not promoting contagion. I think the other thing that we know is that trauma is playing a larger role. I did notice that one of the new trainings that Cognito has come out with is actually an online training on trauma. But we do need to kind of understand that as well. And then I think building resilience in children is also another thing that we have to focus on both as parents and as adults in our community, so that one small setback doesn't lead to a student thinking that, well, then that's it. I don't really have any other options. And then finally, I would say that making sure that we have places to refer children to, so that, I'm a huge fan and advocate for school-linked mental health, so that if we do find a child that someone's worried about, that they're not waiting 3 months to get into treatment, but that they're actually, really seeing someone right away, so that they can resolve that and try to make sure that, the student really understands why suicide is not an option.
Thank you, Ms. Abderholden. Representative Pryor.
Thank you, Mr. Chair. And to follow up with what your comments just were, Ms. Abderholden, is the training, this 1 hour training right now, does it address the contagion and how to communicate to students about that also?
Ms. Abderholden.
Mr. Chairman, Representative Pryor, I do not believe so. There's a whole kind of another work that goes on in terms of safe messaging. We have actually sent materials to all of the school districts in Minnesota several years ago about what safe messaging is and what to do. And we provide, through a grant through the health department, a class called postvention, where you come in after a suicide has taken place to actually provide that kind of training and information.
Representative Pryor. Thank you. Representative Sandell.
Thank you, Mr. Chair. I recognize that this request is just a single-year appropriation. What sort of thoughts do you have for ongoing in-service training or teacher preparation for new teachers? And also, I wonder if there's attention to suicide prevention in teacher preparation programs.
Representative Richardson. Ms. Abderholden. Your choice.
Mr. Chairman, Representative, what we'd like to see is if everyone really loves this, let's continue it, right? If we've had 30 schools, which is 30 school districts, which is small, let's see if this is really popular and people really feel that it's effective, then we would, of course, want to continue it. If something's working right, continue to do that. There is, to my knowledge, there isn't a lot in kind of the teacher education about mental illness in general and suicide prevention, although we are seeing that in general in the community more and more people are at least taking a suicide prevention class because they're worried about it, and anyone who's working with youth in particular is looking to take those kinds of classes so that they really understand what's going on. There are many organizations, not just NAMI, but many that offer the QPR 1 hour class for free. We offer it twice a month for free in our office, just so anyone can come by and be able to take that kind of education. A lot of people know CPR and first aid, and I think the time has really come that people really understand and increase their mental health literacy as well.
Representative Sandell.
Thank you, Mr. Chair.
Thank you. Representative Erickson.
Oh, thank you, Mr. Chair. So, Ms. Abderholden, once the grant is awarded, like it was to Princeton, is there access then to that training ongoing so that it's, more like a permanent software access that the teachers and other staff can use?
Mr. Chairman, Representative Erickson, my understanding is that it's for a certain amount of time and that contract would then have to be renewed. But as many people as you want in that district can take it.
Representative Erickson.
Thank you, Mr. Chair. So Principal from Princeton, Ms.
Principal
Muckenhern.
Muckenhern?
So would you describe for us, Principal, what happened in Princeton once the grant was awarded and how long you can have that?
Ms. Muckenhern?
Sure. We were contacted and we determined a date that it would be open for us. And we had several months, and I'm going to say it was like 4 months. I took the liberty, as is per my position, and put a deadline for our staff because we wanted to see that it would work. And I also required it for everyone, as I also can do, so that we had a starting point for our entire staff. So that year, everyone met this licensure requirement, but we could have had it open the entire first 2 trimesters, I believe. NAMI was very generous with the time, so I probably used less time than I had available.
Representative Erickson?
Yeah, thank you, Mr. Chair. So what will you do in the future then as new staff come on board?
Ms. Muckenhern?
As new staff would come on board, I'd work with the district. There would be a time period, and we would really try to put that in place in that back to school. We have a 3-day training
Yes.
time for new teachers. That's where we'd put it.
Thank you.
Thank you, Representative Erickson. Representative Hewitt?
Mr. Chair, Mrs. McNahern, question for you. They referred to the 2% a little while ago that you use for development.
Right.
What that consist of? Do you use that whole account up pretty much every year with teacher request already?
Ms. Muckenhern?
The 2% of basic revenue set aside is determined at the district, so an allocation is given to each school. This year, the allocation to the high school was about, I'm going to say, $8,000, which is significantly less than 12 years ago, perhaps even more than half, and yet a couple or $3,000 more than a couple of years ago. In our building, not every single decision around that funding is made by, for example, the teacher committee with myself. I have some discretion over that. I create the original budget. We do have teachers that apply for things. So if I had to, if there was sufficient funds, I can pay for, certain staff development days, opportunities. It is a challenge. $8,000 for a staff of 100 and about 52 teachers. That doesn't go a long way. And, I'm sorry.
No.
It's not mine. A clarification of the licensure requirement. I hope I'm not misspeaking. It isn't the responsibility of the school district to provide that. It is the responsibility of a teacher to have that requirement to renew their license. So not all school districts are going to provide this opportunity, which is why I think this is very important for all of Minnesota.
Representative Hewitt?
One follow-up with actually Representative Richardson. Are we looking also at new teachers coming in getting the same training?
Representative Richardson?
Yes, I think that the goal would be also some consistency in terms of having teachers to be able that are coming in new to be able to have access to training as well. And as Ms. McInerney was just saying, there's a responsibility for teachers to be able to get the training, and this is going to be a way for schools to be able to help, I think, erase some of the barriers to access.
Excellent. Thank you, Mr. Chair.
Thank you. This is a public hearing. Is there anyone in the audience who wishes to testify either before or against House File 813? Seeing none. Representative Richardson, any closing comments?
I would just like to thank all of the testifiers for coming in today and coming as far away as from Princeton to share their experience.
Thank you very much. With that, Representative Richardson renews her motion that House File 813, as amended, be laid over for possible inclusion in a future Education Finance Division report.